Hoki mai anō, welcome back. The Nurses Union is calling on the government to drop financial barriers for nursing students.
It wants solutions like free training and payment for work placements to stop student nurses from dropping out. As Alexa Cook reports, they say it's urgent as the healthcare sector is crying out for more nurses.
This may look like a hospital ward,
Kia ora.
but it's actually a simulation suite for nursing students.
A lot of effort goes into making it as realistic as possible.
Realistic, so once they get into a real hospital, they're ready to help ease the pressure on the healthcare sector.
We're coming, we want to help, we're excited.
But before they can graduate and help,
Lovely.
nursing students need to complete at least 1,100 hours of clinical practice. It's all unpaid, which is often a huge barrier.
But if we pay builders as apprentices, why do we not pay our student nurses in the same way? That'll help keep people in class, keep people in school, because we have had people drop out because of that one reason.
Like Veronica Hall, who had to work during unpaid placements to support her family.
I withdrew from the course due to working constantly and not having any time for study.
She's one of many. A joint DHB report found nearly a third of nursing students drop out.
Financially, it was really straining, but when you know you're not getting paid, it can be quite draining and exhausting.
A petition to pay student nurses on placements has reached almost 13,000 signatures.
They can't pay their electricity bills, they cannot put food on the table, they can't pay for care of their children. It's a huge barrier.
And with more than 4,000 nurses needed nationwide, the union wants urgent government action.
We need to make it easier. We need a whole lot more nurses. So first of all, we would like free fees for education. We would like costs to be paid for placements.
The Health Minister told Newshub fees are unlikely to be dropped, but he is looking at more support for placements.
What kind of help is on the way for these students that you're working through at the moment?
Well, as I say, I know the issue and solutions to them are being considered, and when we're ready to, we'll make some announcements about that.
I'd be happy if they gave me $10 a day. I'd be like, yes, petrol money.
But even if more students could be encouraged into study, they still need on-the-job training. For today, nursing programs could double the number of students studying here every year, but there aren't enough placements available in the healthcare sector, especially when it's under so much pressure.
You need those experienced registered nurses to provide what we call direction and delegation to keep those students actually safe.
That could include former nurses returning to the job. Those nurses can tap into $1 million fund to retrain, but the union worries it's not enough.
We're certainly looking at continuing that and hopefully expanding that as well.
One of the many conversations the sector is desperate to have with the minister.
I'll wait by the phone for the call.
Because in a healthcare crisis, every penny and every nurse counts. Alexa Cook, Newshub.